problems, it can cause heart problems, it can cause kidney problems, it can cause foot problems. So top to bottom, everything. And it can cause sexual problems. Erectile dysfunction is a very common component of diabetes. So all these things primarily happen because of the vascular, which means that diabetes chokes our nerves, our vessels. So the blood flow to these organs gets reduced. So we are choking the blood. It's not reaching these places. In a very crude way, I mean, that's how all these organs get affected. Some are small vessels, some are large vessels, but basically it's a blood flow that gets affected to these organs, and therefore all these diabetes, the next slide is a bit scary. So the risk of blindness in diabetics is 25 times more than general population. Risk of kidney failure is 17 times more. Risk of amputation, I mean, that's really scary. Risk of heart attack is 2 to 4 times. But most of this is preventable. These are data from times when patients were not treated properly. I always explain to patients, treating diabetes is like buying insurance. Why do you contribute to your insurance every month, every year? Why do you do that? Because you're worried about end of the road somewhere, Same thing with diabetes. If you control your diabetes, cholesterol, blood pressure well, you're buying insurance for your kidneys, for your eyes, for your heart. And I think that's how you have to look at it really, because it's a huge economic and social burden which no society can handle. So we agree it's common, we agree it's serious. But I have to show you that is it preventable? Can we do anything about that? And that's the main thrust today. Is it really preventable? Is the disease preventable? Are the consequences preventable? The consequences of diabetes, like heart, eye, kidney, clearly can be reduced to a huge degree by good control of diabetes, blood pressure, cholesterol. No confusion. So we won't spend time on that. It's well established, you must have heard it, and it's very clear, but not just by diabetes alone or blood pressure alone, or you have to do all three together. And it works beautifully. And also, the challenge of not taking medicine. If there are two people, two diabetics, one guy is really well controlled on medication, the other person is doing very good lifestyle,